Continuing Mobile Education for Emergency Medical Services Providers. Episode 3 Don't Talk to Me Like That Communicating with Respect. Participants will explore their own prejudices towards older adults. They will recognize phrases and patterns of speech which may offend the older adult, and they will describe 3 ways to improve communication with the older adult.
I've certainly heard stories from patients, both positive and negative, with regards to their interaction with EMS personnel. Those that have so clearly embraced the services of the EMS providers have seen them really as guardian angels in some respects. When they've sustained a fall at home and they're able to get them up and transport them to the hospital and treat them with respect throughout, that they remember that, and that has a very significant implication with regards to their subsequent interactions with personnel. The negative stories that I certainly have heard relate mainly to issues of communication, where personnel do not talk to the patient, they talk to other family members or caregivers that are present, that make the assumption that the person has dementia or that they're hard of hearing, or shouting at that person. So I think it's some of these snap judgments that are made and not including the patient. Those are the ones that have the potential for having that greatest level of harm for that relationship between the EMS provider and the patient.
Sure. When you're approaching any older adult, I think many of us tend to move right into slang, if you will. Honey, gramps, grandpa, grandma, etc. That's probably not the most appropriate means of addressing these older individuals. And so, again, generally, I continue to address everyone as ma'am or sir, Mr. or Mrs., in ensuring that I don't jump to any conclusions. And if they tell me, please don't call me sir, that's what I called my father, then I ask them what they would like to be called.
Because they come from a whole different generation. They come from a generation where it was Mr. and Mrs. using a last name, or a grandma or grandpa, or mom or dad. So they were always referred to with titles, you could almost say. So when speaking to them, you should always ask them, are you comfortable with me calling you Mrs. So-and-so, or may I call you Lucille, or may I call you Frank? Just showing them that respect level helps quite a bit.
To communicate with respect, use Mr. or Mrs. when initially greeting the patient. It's okay to ask the patient what they would like to be called, and don't use familiar titles unless given permission.
This is a common problem, I think, in healthcare, is that many medical providers will make some snap judgments about older patients. And really, if you think about this, this represents a form of ageism, of really discrimination against those that are older. We oftentimes make snap judgments with regards to an older patient being frail, not being able to care for themselves, those having cognitive issues, they have dementia or hearing loss, and oftentimes these are snap judgments that patient can't participate in giving a history or participate in their decision making, when in fact the vast majority of older adults have the capacity to do that. And I think that's the common error that I see, is that a lot of times these snap judgments are made, and many providers will begin to sort of pigeonhole an older patient into a stereotype. And I think that's where it's important that we acknowledge that up front, and we begin to approach every older patient as an individual, and regardless of how they appear or how they're interacting at that point, to treat them with a basic respect and acknowledgement that they are valuable members of making decisions about treatment and following recommendations from healthcare providers.
Well, again, I think when we're talking about culturally competent communication, I think again some key things. Number one is don't make any rash assumptions. Many of these individuals, having been around for a little bit longer than I, have gone through some pretty significant life experiences through those times, and they may be very sensitive or very hesitant to engage the medical community because of that. And so that means that I take a few extra minutes to explain what I'm doing, to explain what care I'm providing and why I'm doing it, why I'm putting a 12-lead monitor on, why I'm giving them oxygen, why I'm placing an IV or checking their blood glucose, in addition to addressing them in a professional manner. So, ma'am, sir, and using their last name rather than their first name. These older adults typically understand that with greater respect. Further, simply talking in a normal tone of voice until you determine that that's not the best way to communicate with them. So don't make the quick assumption that they are older, they can't hear you, therefore I must talk louder.
Avoiding ageism. Don't assume the patient may be impaired because they are older. Avoid terms the patient may not be comfortable with, such as old or frail, and remember to address the patient with professionalism and respect. After this episode, you should have explored your own prejudices towards older adults, recognize phrases and patterns of speech which may offend the older adult, and describe 3 ways to improve your communication with the older adult.